So Martin, how is this medicines availability information service going to work in theory?
Well, our proposal might be that in conjunction with a third party, such as the Department of Health or the MHRA, that we, as wholesalers, are able to provide a process which will globally cover the medicine supply in the UK and identify certain criticalities, whether that's either a spike in demand because of no-deal Brexit issues, or perhaps in the longer term where there might be a serious shortage of a particular product that we've identified through our own information systems. And if we have a third party that could be trusted to collate all this information and then provide an information service to the supply chain, both up to manufacturers and back down, particularly to community pharmacists, that a particular product is in short supply and why, then I think that would be quite an achievement in the supply chain and something very useful. Information is key, and I think if we can broker something like that with, as I say, a trusted third party, then that might be a service which could be of interest, but also provide some confidence in the supply chain and develop the trust I was talking about earlier.
And have you had any support from other parties for this proposal?
Well, certainly because of having to deal with a no Brexit deal contingency plan with the department, we've certainly established benefits of trying to provide a radar and a scanner on current demand, and we've implied that as an association this year we want to try and take forward the availability issues that we know dispensers and community pharmacists in particular have been experiencing over the last 6 to 12 months, and work with other stakeholders, including manufacturers, to see if we can improve the information supply and transparency within the supply chain. And I think we have been doing some work because of Brexit planning, which we ought to carry on into the world after whatever happens on March 29th, to try and deal with longer term shortage and availability issues, but particularly availability issues which are more about delays than actual shortages.